Hello, this is Tessa Kegel and this is HBS5OHC, Identifying and Controlling Hazards, Workplace Biological Hazards and Diseases, Measurement and Management of Chronic and Acute Exposures and Effects on Workers' Health. And this is Module 6, Part 2. This is the Commonwealth of Australia Copyright Warning Act 1968, and these recordings are covered by this Copyright Act. Now, there are a number of different diseases which are caused by microorganisms. I'll just go over a few here, but there are many others as well as these. So first of all, hepatitis B. Now, Hep B is the most serious form of hepatitis. It's an infection of the liver caused by the Hep B virus. The virus is found in bodily fluids such as semen, saliva, blood, and urine. Hep B is a viral disease that affects the liver. Due to the vital role of the liver, this virus can cause serious illness and may result in death. The immune response of the liver causes most of the damage to the liver. Hep B is one of the most prevalent sexually transmitted diseases in the world. There are an estimated more than 300 million carriers worldwide. One of the reasons why Hep B is so dangerous is that the virus can survive outside the body. Reservoirs of infection are the blood and blood products, saliva, semen and vaginal fluids, and although the virus has been isolated in urine and feces, it's not been proven that these are infectious in these products. Some people become carriers of the Hep B virus. This means that the virus stays in their body for their whole lives. In some population groups, a lot of people are infected when they're children, and as many as 1 in 5 people are carriers. Hep B is spread by contact with the blood and other bodily fluids, usually through a breach in the skin or contact with the internal lining surfaces of the body. If the infected blood enters another person's bloodstream, that person may acquire the disease. The severity of Hep B infection ranges from no symptoms to a severe illness, which in some cases may be fatal. An estimated 15 to 20% of chronic Hep B carriers will die prematurely of either cirrhosis of the liver or liver cancer. It's thought that most Hep B may be the cause of up to 80% of all liver cancers worldwide. Most people fight off the infection themselves. Approximately 5 to 10% of adults who are infected with the virus become carriers. It can take 45 to 180 days after infection for symptoms of illness to appear, with the average being 60 to 90 days. The appearance of the Hep B antigens, or markers, on a blood test can occur as early as 2 weeks after the infection, or at any time up to 9 months after the time of infection. People who have immunity and normal liver function tests do not need any treatment. However, people who are chronic Hep B carriers with liver damage do not require treatment. However, if there is liver damage, antiretroviral drugs are effective in about 30% of people who meet specific criteria. A form of prevention is available for Hep B, basically the Hep B virus, Hep B vaccine. A vaccine is available, and immunisation is the most effective way to protect against Hep B infection. So next, HIV and AIDS. HIV, or human immunodeficiency virus, is a retrovirus. The virus attacks the body's defense system, making it more susceptible to various infections. Acquired immune deficiency syndrome, or AIDS, is a collection of clinical manifestations that is indicative of immune system dysfunction. The clinical manifestations include infections and tumours secondary to infections. The virus enters a person's bloodstream where it attacks white blood cells, which are part of the immune system. The virus enters T4 cells, making them produce more viruses. Eventually, this kills the T4 cells, and there's no longer protection against the infection. Diagnosis generally occurs when the immune system breaks down and requires special tests which show whether the virus has entered the bloodstream. These tests do not, however, show the stage of the illness, nor do they differentiate between HIV or AIDS. It takes between 2 weeks and 3 months following infection for HIV antibodies to be detectable by a blood test. Of those who were infected, 50% developed serious infections and cancers within 10 years of initial infection. Another 20 to 25% developed milder AIDS-related conditions. Some of these people developed more serious conditions later. A small percentage of individuals did not show deterioration in health after 10 years. The incubation period ranges from a few months to 5 years or longer, and is the period during which there is no sign that a person is infected. Signs and symptoms may develop a few weeks after infection. Symptoms may last a few days or weeks, similar to the glandular fever or to flu, then resolve temporarily. Later, severe symptoms, including cancers and neurological conditions, may occur, but not all HIV-infected people will develop AIDS. HIV is transmitted through sexual intercourse with an infected person, through blood, principally through blood transfusion and the use of non-sterile injection equipment or organ and tissue transplant, through other bodily fluids, from an infected mother to an infant, or by sharing an infected hypodermic syringe or needle. All blood donations in Australia have been screened since May 1985, which has reduced the risk of that mode of transmission. There is no evidence of transmission through normal contact of a non-sexual nature, although this is often misunderstood in workplaces. In some countries, the risk of HIV infection is very high. Although HIV is rarer in Australia and more difficult to acquire than Hep B, prevention issues in the workplace are equally as important. Workplace prevention should include what have been known as universal precautions. So this includes the wearing of protective clothing and equipment and hygiene procedures. And to find out more information about these, you can refer to the NHMRC website. So next, we look at Legionnaire's disease. Legionnaire's disease is caused by a gram-negative bacillus, the Legionella bacterium, and is a serious form of pneumonia. The first known outbreak of the disease was in 1965 at a hospital in Washington, D.C. The first case of Legionella were identified in 1976 when there was an outbreak of respiratory illness at a Philadelphia hotel during a convention of the American Legion members, hence the name Legionnaire's disease. This outbreak caused 29 deaths. Legionella's reservoir of infection is thought to be aquatic, mainly hot water sources. Water heaters, cooling towers and air conditioners are common sites for the breeding of bacteria. Legionella has also been detected in mud from natural sources such as rivers, ponds and streams. The bacteria multiply intracellularly and cannot reproduce without the help of protozoa like amoeba. A single amoeba can hold enough Legionella bacteria to cause infection in a human and can be contained in one droplet of aerosolized water. This disease is a possible risk to the entire population, especially those who are employed in the fields that have to deal with the bacteria's reservoir sources, such as plumbers, maintenance fitters, and so on. The disease can infect systems in large buildings and thus be a risk for office or other similar workers, and also for members of the public exposed to the general air surrounding an infected site. Other workers at risk may be nursery or outdoor workers exposed to moist soil or soil and water environments. The risk of infection is greatly increased if the worker smokes or suffers from underlying disease, such as chronic obstructive pulmonary disease, or a condition which suppresses immune systems, or if they are elderly. Thus, outbreaks in healthcare facilities are not uncommon. Prevention of Legionella bacteria in working environments is by way of constant cleaning and upkeep of the mechanical reservoirs, such as cooling towers, with a water treatment, such as chlorine, to kill the bacterium at the source. Legionella only multiplies at certain temperature ranges, and thus water temperature needs to be monitored. Treatment is to eliminate the infection with antibiotics, with the primary choice being erythromycin. Influenza. Influenza is a very common condition that can be highly contagious, and epidemics have been known to impact significantly on worker and public health, as well as workplace productivity. The recent international swine and avian flu epidemics have demonstrated how quickly the condition can spread across continents and within communities. Influenza is spread via exposure to droplets of body fluids, usually nasal or oral secretions that contain the virus, which make contact with the recipient's face, upper respiratory tract, and their nose and mouth. Influenza can be spread by individuals in close contact, sharing workspaces, public transport, and so on. Workers who are in direct contact with the public, such as teachers, retail staff, and healthcare personnel, are at greatest risk of picking up and sharing this infection. Now, there are a range of different occupational groups which are at greater risk. People working in the healthcare network are especially vulnerable. These workers have a high level of exposure to blood products, and bodily fluids. In large urban areas where the general population may consist of people who have been carriers of particular viruses, the risk to the healthcare worker is far greater. Tattooists and body piercers use needles on a regular basis and may become exposed to blood from tattooing or piercing from the needle. As with healthcare workers, needle stick injury with infected blood can occur, or infected blood might pass from client to worker through an exposed cut and the presence of fresh blood from the client having the task performed. Sex industry workers, through sexual contact of various kinds, can be at very high risk. Other high-risk occupations include those with high exposure to human contact, particularly of an unpredictable nature, such as childcare workers, police, emergency workers, prison workers, and military personnel.